Hi, I'm Dr. Tim Carter. I'm a neurologist here at Health First Medical Group. I went to medical school at the University of Florida, did a year of internal medicine after that in Virginia at the University of Virginia affiliated programs in Roanoke, and then I did my neurology residency and fellowship in Charleston at the Medical University of South Carolina. My practice focuses on primarily diseases of the peripheral nervous system. So we concentrate on testing, diagnosis, and treatment conditions that involve the nerves out in the arms and legs as well as the muscles. But patients don't show up with those types of diagnoses. They show up with a problem like trouble walking. And so our job as neurologists is to figure out, is this trouble walking related to trouble with the nerves in the legs, or maybe a problem impacting the brain like Parkinson's disease or a history of stroke. Parkinson's begins usually somewhat insidiously. The initial symptoms can be fairly minor, a little bit of tremor, a little bit of difficulty with balance or gait, a little bit of stooped posture when walking. And then the progression from there differs from one person to the next, but typically the symptoms do get worse over time. And that time frame is often years and years, so sometimes the symptoms can creep up on folks and accumulate, and they have a fair number of these symptoms before they realize that there's an issue and show up to their doctor. So treatment of Parkinson's disease involves several different approaches. Certainly medication can be employed, but that's not always the first line of treatment that we'll employ. Often actually physical exercise can be very useful in the treatment of Parkinson's and may even help slow down some of the symptoms. So as Parkinson progresses, the symptoms do tend to become more severe. There can be increased risk for falls that require increased vigilance on the part of caregivers. There can also be trouble with swallowing and other problems that also need to be closely monitored. So it becomes a condition that does impact the entire family.